Michelle, when you were diagnosed with ovarian cancer, were you offered any kind of mutation testing at that point?
I never even heard of it when I was diagnosed, but yes, we right away went and got the testing done.
And how soon after your own diagnosis were you aware that there was this association with a genetic abnormality that could be tested for other family members?
It was pretty quick. I think it was within a week.
Is that common, Dr. Secord, for patients
surgery,
to be informed?
I knew.
So the current guidelines, well, for a week, I think that's really quick turnaround. That's awesome.
I think so.
I think
because I remember the woman called me, and the first thing she said is, "You're the same person you were yesterday. You're the same person this morning, and tomorrow you're going to be the same person." So right there, I'm like, "Okay, it's positive, right?" And it was, but I didn't feel any different. I just didn't know a whole lot about it.
Were you given any advice as to how to talk to other family members?
Oh, yeah, absolutely. They gave you a pamphlet, and it talks about your risks, and it talks about your family risks. In fact, I think they even had a standard letter that you can send to your family members if they're out of the country, and just to let them know, hey, look, this is what I have, and this is what's going on with me, and it's beneficial for you to check into this. I think mine was $350, the price, which I thought was reasonable.
And who in the family went on to get tested after your own test came back positive?
I'm a middle child, and of the siblings, one brother has passed away. Everybody's been tested except for my younger sister. And my 2 daughters were tested, and everybody's negative.
And why was your younger sister not tested? Was that her decision?
That was her decision. She feels she doesn't have a whole lot of money. I was talking with you about this, but she doesn't have a lot of money and just feels she doesn't need to get tested.
Do you think it's the financial limitation that's behind her decision?
In her case, yes. And maybe a little bit of fear on her part.
Diane, for patients where there's a financial restriction to have these tests, can you be a little bit more specific in how do patients get the financial help they need to get these so valuable tests? There is obviously support out there for patients in the same situation as Michelle's sister, yes?
Exactly. So as I mentioned, many of the labs offer some type of financial assistance or at least some type of a program where they can pay for the testing, over a period of time. And then really it's just the support that we offer from Force. We do have a program called Peer Navigation that a person can talk over the phone with a trained peer navigator volunteer, and one of the topics that they can choose for this peer navigation program is financial services. And so we can direct them to different things that may be in their area or a national program or through the labs to help them find what they need to get their testing.
Your program's awesome.
Thank you.
It's fantastic.
And we're going to end this segment by talking a little bit more about Force in a few moments. Dr. Secord, how do you counsel patients as to what to do with the information, when they should do surveillance, when they should be more proactive and have surgery? And are there patients who really don't need to do anything?
Well, if someone has these mutations, and we're concentrating mostly on BRCA1 and BRCA2, but I just want to throw out there too, the other areas, other mutations that have been identified are BRIP1, RAD51C, RAD51D, and then there's several mutations that are linked to another syndrome called Lynch syndrome. There are guidelines that are already out there. National Comprehensive Cancer Network has put them out. If anybody wants to Google that, they can, about when to have the surgery done and then what are the other options. So the main options that we talk about is really going to be based on someone's age. I mean, I think, Diane, you've lived this, so when are you done having your children? How old are you? What are your thoughts about menopause? So patients with BRCA1 mutations, they're at risk for having earlier onset disease. So the current recommendations are to think about surgery at age 35 to 40 when they're done having children, and that's really young.
Now, Angelina Jolie had breast surgery and ovarian surgery. when somebody has a positive mutation, are we talking about surgery for breast removal and ovarian removal? Is it both? And if so, should one come before the other?
So fantastic question again. And I think that's an area that people don't completely understand the sequencing, and they discuss those options with patients. I do want to add that if somebody has a BRCA1 or 2 mutation and they had their ovaries removed before a certain age, they actually get a great benefit in reducing their breast cancer risk. So it can reduce it by, I think, as much as 50%. 50%. Yeah. So one of the areas of interest going forward in ovarian cancer prevention, and I mentioned, tubal, ovary, and peritoneum all go together, right? Is can you save the ovary and just take out the tubes and prevent all these cancers? But one of the concerns about that approach is that if women do that and they don't remove the ovaries, they're not getting the breast cancer prevention.
Right.
But if they opt to have a mastectomy, they may not be as relevant. So you can see that there's so many moving parts right now to this that we don't really know all the right answers.
And so for women that may be considering surgery to remove the ovaries, who are done with having children, but may still be in those reproductive, valuable years where the ovaries are making estrogen, what are the risks of losing the estrogen in terms of your bone health? And if somebody's carrying these mutations and they're undergoing surgery to remove the ovaries, is it safe to give them hormone replacement therapy to prevent side effects of losing that estrogen for bone health, or is that off the table?
Okay, so the hormone, oh my gosh, that is like a whole nother can of worms. So I'm going to try to be as brief as I can. If some of these women, when they come to you, they already have had breast cancer. And so if they have a history of breast cancer, their medical oncologist really, for the most part, advise that they avoid any hormone replacement therapy, estrogen or progesterone. Some of these women may not have had breast cancer. They may have had a mastectomy. And so no history of breast cancer. They had their prophylactic surgery to remove their ovaries. Whether or not you do hormones, whether it's estrogen plus progesterone or estrogen only, depends if they still have their uterus or not. Okay? You can see how complicated this gets.
Absolutely.
And then in terms of the big picture, you mentioned you remove your ovaries, now you're at increased risk for menopause symptoms, osteoporosis. I mean, you all are living it, right? Cardiovascular risk, depression, anxiety, and metabolic syndrome. I mean, that's just to name some of the things that go along with losing your ovaries early. There was a wonderful study that tried to evaluate this issue in women with BRCA1 and 2 mutations. In women who had those mutations, the risk of having those other issues with removal of your ovaries, they don't outweigh the benefit of having those ovaries removed in terms of reducing your risk of ovarian cancer, breast cancer, and improving your overall lifespan, right?
So I think the most important point for the viewers and people who are looking at this, there's a lot of questions. This is not a 5-minute conversation in terms of undergoing testing, but also deciding the overwhelming threat of loss of both breasts, both ovaries, and all the fertility issues and the hormonal issues that go with that. It's so important that women understand the risks and the benefits of this. Now, if a patient has got through all of those counselling issues, we're talking here about surgery to remove organs that don't yet have a diagnosis of cancer within them. How's that viewed by the insurance company? Are you going to get that surgery covered by insurance if you're high risk?
If they have the mutation, I have never had a situation where the insurance company has denied coverage.
Yeah, we don't hear about it either in our programs.